Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter G. Today I'm going to talk about a condition called the Guillain-Barre disease. First of all, let's bring out the important concept. Is there any condition that associated with this Guillain-Barre disease warrant emergency visit? Yes, this neurological disease will have the risk to lose the innervate for the respiratory muscles. So if that's the case, we have hypoxia, difficulty breathing. It's very dangerous. So if that's the case, I feel like shortness of breath, difficulty breathing. I feel the weakness of the muscles around the chest and also the diaphragm. So if that's the case, that's really is the life-threatening situation. Need to see the emergency department right away. A lot of patients with this kind of disease undergoing the intubation because of the weakness of the respiratory muscles. Can you manage at home? Probably depends. Usually it's not. But during the recovery stage, probably just observe and monitor, but has to be managed with the supervision of physician. Probably you cannot manage at home. Previously, I think couple of decades ago, I think this disease is, as long as the respiratory system is secured, no impaired respiratory muscles, so probably it's self-limited, but it's not. Nowadays, I think it definitely has to be managed by the physicians. So what is this Guillain-Barre disease? It is autoimmune caused, peripheral neurological disease, demyelation, and is ascending from the extremities and to the center. And the mechanism, because it is immune caused, so particularly after the infections, viral infections or the bacterial infections, there's a special association of this Guillain-Barre disease with the bacteria from the intestine called Campylobacter jejuni. So this is the special bacteria. After this bacteria infected with diarrhea, a couple of days later develop this weakness, generalized weakness. It's ascending nature, which means start from peripheral, feel the weakness of the lower extremity, and then ascending to the center. That's why to the respiratory muscles, and that's what I talked at the beginning, which is really life-threatening risk, impaired breathing functions. So how to, and also some viral infections, and how to diagnose it, usually clinical and also the blood test. Especially there's elevated lymphocytes and no white count, which means the neutrophil is not elevated and the lymphocytes are elevated, and also the proteins are changed, altered. And the diagnosis, or sometimes probably imaging study and a muscle analysis, myelogram. So, but it's usually treated with the during acute phase. Probably the best way is the immunoglobulin injection for probably about less than a week, or sometimes need to change plasmapheresis to get rid of the antibody and to recover. And there's another special condition associated or similar to this. It's myasthenia gravis. It's a little different, but this they both are the peripheral diseases. But the second one was the antibody against the acetylcholine receptor, so that which caused the weakness from the center and along the day. So in the morning they were okay, they were not feel tired, but with the day going on, they feel, because of this acetylcholine was exhausted, so couldn't have another production, or the antibody already neutralized this neurotransmitter, so then caused weakness during the day. along with the time going. So these are the two, they both peripheral neurological disease, they both immunological caused. The first one, autoimmune caused, but just that the target site is different. And the treatment similar, they both treat with the immunoglobulin, and in terms of the other characteristics, in terms of the age, they both probably the similar, young or middle-aged people, or could be older, and also female and male both. But so then that's the really the differential of these two diseases through the test, the blood test, and to identify different antibodies. So this is the take-home message. If it's like this: if you have this after the upper respiratory infection or after diarrhea, you develop this weakness, and it's kind of, you think, oh, probably just because of diarrhea, but sometimes it could caused by diarrhea or lost balance of the electrolytes, could have this kind of similar, but it's different. The Guillain-Barre has more risk with the impaired respiratory muscles. So that's the case. You really, if a couple of days after the diarrhea, you feel this weakness, and particularly if it is ascending from the lower extremity to the center, you feel the weakness gradually coming up from the lower extremities. Then if that's the case, you really need to talk to a physician or go to emergency room to get it checked, particularly if you feel difficulty breathing. So this is very superficial, and just touch some fundamental basis about this Guillain-Barre disease. And the disease was named by a physician. So I hope it helps, and thank you for watching. I will see you next time.